I move the business of the Senate Notice of Motion number 2, standing in my name, and I'm really proud to stand and move for this inquiry today, and I acknowledge the support of the co-sponsor of this motion, Senator Marielle Smith. I'm so proud to be establishing, with the support of this chamber, a Senate inquiry into menopause and perimenopause to understand its health impacts and its economic impacts on women and people who menstruate, and the impacts on the broader economy. Now, menopause and perimenopause is not really spoken about much publicly. In fact, the first mention on Hansard of perimenopause is from me about a month ago. But we need to be speaking about these issues, and we need good policy to address the impacts that they're having on women individually, on workplaces, and on women's financial security in particular. Menopause happens between the ages of 45 and 60, and perimenopause, which precedes it, can last for up to 10 years and begin as early as your 30s. Both can be physically and mentally debilitating, with significant financial and mental health consequences. People experiencing physical and mentally debilitating menopause and perimenopause symptoms have been far too long forced to suffer in silence. Women are sick of being invisible and our health needs neglected. We need good policy to address the economic, social and health impacts of peri and menopause. This inquiry would look at the economic, physical, mental and financial impacts of menopause and perimenopause, as well as the cultural perceptions and attitudes about a health issue that's affecting more than half of our population. 80% of Australian women experience menopausal and perimenopausal symptoms that can range from mild to extremely severe, 80%. Now, the financial impact of that can be profound for women as well as for their employers and the economy, as many women at the peak of their career are leaving the workforce. Menopause can cost Australian businesses more than $10 billion annually, according to the Macquarie Business School, and the Australian Institute of Superannuation Trustees estimates that if even just 10% of women retired early because of menopausal symptoms, it would equate to a loss of earnings and super of more than $17 billion each year. Now, we already know that women are retiring 7.4 years earlier than men, often at the height of their careers, and that contributes to the 22.8% gender pay gap. Being forced to retire early exacerbates both that pay gap and the superannuation retirement gap. Now, the gendered cost of treatment is yet another financial burden that only women face, on top, of course, of the costs of a lifetime of menstruation. We need evidence-based policies to reduce the impact of menopause and perimenopause on women's participation in the workforce, and we need to be looking at the adequacy of existing leave entitlements. And in that vein, I credit a number of unions who, for the last year or so, have been surveying their members already and started campaigning on this issue, proposing a policy to give employees who have either painful periods or menopause symptoms paid leave, similar to the family and domestic violence paid leave policy, which is now, thankfully, a legislated one. On the health impacts, we also desperately need more awareness by GPs and by patients of the symptoms of peri and menopause, so that people know what's happening to them and know what treatments are available to them. And importantly, we must make those treatments affordable. And once this inquiry is on foot, we'll be inviting submissions from women, from health professionals, from employers and from experts about what federal funding and what federal policies need to be developed to support women in this phase of life, this very long phase of life. And I'm particularly interested to hear, not just from the experts, because we know they'll be very useful in guiding our policy development process, but really interested to hear the lived experience of women who've either had a good experience or who conversely have had a really terrible experience, either on a health lens or with their workplace dealing very poorly with what is a perfectly natural part of life. Many women have already shared their stories with me, including Sonia Lovell, who was taken out of work for several years after experiencing induced menopause when she was treated for breast cancer at age 47. Sonia experienced many of the lesser-known symptoms associated with menopause: impaired cognitive function, irritability, mood changes, These will sound familiar to many of the women in this chamber, as well as night sweats, but she couldn't find the support that she needed. Instead, her GP put her on antidepressants. It was only after her own research and conversations with other women, because the sisterhood works, that Sonia identified that she was transitioning through menopause. It shouldn't be this hard to identify a health issue affecting half of our population. Many people who transition through menopause don't have the information they need, they don't have the support they need, and they're not prepared. So as well as experiencing the symptoms of peri and menopause, not being able to identify what's happening and why is frustrating and can take a huge toll on people's confidence. A study by Circle In and the Victorian Women's Trust in 2021 found that 73% of women say that stress and anxiety levels are higher than usual for them during peri and menopause. And yet 70% of women who've experienced menopause say they don't feel comfortable talking to their manager about their challenges or their needs. Women have been fighting an uphill battle for equality in the workforce for so long that it's actually hard for us to name these struggles and talk about them. We fear yet another reason to discriminate against us and another barrier in the way to workforce equality for us. But if we don't talk about these issues, nothing will ever change, and we are sick of suffering in silence. The study that I mentioned also found that 30% of respondents that have experienced menopause said that they felt disconnected or distracted from their workplace, and 45% of respondents said that they considered retiring or taking a break from work when their symptoms were severe, but the majority of those didn't go through with it because, frankly, they couldn't afford to. So menopause can impact more than just physical health and financial circumstances. There can be significant impacts on mental health, on personal relationships, in the workplace and on a person's quality of life. We desperately need more awareness by GPs and also by patients of the symptoms of peri and menopause, so that people know what treatment is available, what's going to be most appropriate, and ideally we need some policies to make sure that those treatments are actually affordable. Professor Susan Davis, who's the head of the Monash University Women's Health Research Program, and who's also a past president of the Australasian and International Menopause Society, is currently recruiting for a study to provide the most up-to-date knowledge of Australians' women's experiences of menopause. I encourage anyone who's interested in participating in that to Google Professor Davis and involve themselves in that really important large data study, which will help guide our decision-making in future. Professor Davis also has the MenoPrompt project underway, which is to develop a comprehensive practitioner tool to improve the care of women at and after menopause, including the needs of women with early menopause and screening for conditions influenced by menopause, notably bone health. I might also add that Flinders Uni is running a registry called Vital, led by Professor Erin Morton, which I've mentioned in this chamber before. Likewise, Professor Morton's calling for people to share their menopause and perimenopause experiences to help build that evidence base and to design better policy responses. So please get involved in both of those studies. Those sorts of resources will be invaluable to build our understanding of how menopause and perimenopause impacts people who menstruate, and increasing the awareness of the symptoms, but also the treatments that might be available. Last week, the New South Wales Government launched the Perimenopause and Menopause Toolkit, a resource to raise awareness in culturally and linguistically diverse communities. I thought they deserved a shout-out, and more resources like this are very much needed to improve the awareness of symptoms and the access to treatments and support. Likewise, earlier this year, the West Australian Parliament committed to becoming certified as a menopause-friendly workplace. Quite a new concept in Australia, and one that I hope the inquiry will look at and examine further. And last week the Victorian Parliament followed suit and also said they would seek certification. Hopefully this encourages more workplaces, maybe even the federal parliament, to consider itself becoming certified as a menopause-friendly workplace. You can always live in hope. Women are sick of being invisible and their health needs being neglected. We desperately need to develop good policies to address the economic, social and health impacts of peri and menopause. So I'm really pleased in the conversations that I've had that there's been significant interest around the chamber in this inquiry. I'm not surprised, but I'm very pleased. And I'm really looking forward to the strong participation from everyone out there who's affected by peri and menopause. I'm expecting that there will be lots of folk who engage with this inquiry, and I am particularly hopeful that we can build that evidence base and finally design the policies that we need to make sure that women are being respected and well looked after by our federal health policies.
Authorised by L Waters, Australian Greens, Canberra.